MedHistory.
Ichthyosis is a hereditary skin disease that occurs according to the type of dermatosis. It is characterized by a diffuse keratinization disorder and manifests itself in the form of scales on the skin that resemble fish scales. The main cause of ichthyosis is a genetic mutation, the inherited biochemistry of which has not yet been deciphered. Disorders of protein metabolism, when amino acids accumulate in the blood, and disorders of fat metabolism, which are manifested by an increased cholesterol content, are the main manifestation of a gene mutation that leads to ichthyosis. The main cause of ichthyosis is a genetic mutation, the inherited biochemistry of which has not yet been deciphered. Disorders of protein metabolism, when amino acids accumulate in the blood, and disorders of fat metabolism, which are manifested by an increased cholesterol content, are the main manifestation of a gene mutation that leads to ichthyosis. All metabolic processes decrease, the thermoregulation of the body is disrupted, and the activity of enzymes in the oxidative processes of skin respiration, on the contrary, increases. In patients with a gene mutation that causes ichthyosis, a decrease in the activity of the thyroid gland, adrenal glands, and gonads gradually increases or immediately appears, and a deficiency of humoral and cellular immunity increases. Impaired absorption of vitamin A, along with reduced functions of the sweat glands, leads to a violation of keratinization of the skin towards hyperkeratosis, since excessive production of keratin with an altered structure occurs, which, together with a slowdown in the process of rejection of the keratinized layer of the epidermis, causes manifestations of ichthyosis. With ichthyosis, amino acid complexes accumulate between the scales, which have a cementing effect, so the scales are tightly interconnected, and their separation from the body is sharply painful. Mutations can occur accidentally during fetal development, sporadic non-familial cases, or be transmitted from parents, hereditary ichthyosis. Types of inheritance. An autosomal dominant mutant gene is transmitted from one parent who has ichthyosis, so vulgar and epidermolytic ichthyosis is inherited. X-linked recessive develops only in men who have one X chromosome with an abnormal gene. An autosomal recessive mutant gene is transmitted from both parents who are carriers, so lamellar and fetal ichthyosis are inherited. Complications of ichthyosis. With ichthyosis of any form, hair, nails, and teeth are involved in the pathological process. Dry, brittle hair is characteristic. Nails break off and delaminate. Multiple caries joins. Ichthyosis is often manifested by eye damage in the form of chronic conjunctivitis and retinitis. Patients have a predisposition to myopia. Due to reduced immunity, purulent pyoderma, fungal mycoses, and allergic diseases, atopic or contact dermatitis, sometimes develop. Later, the work of internal organs may be disrupted. Heart failure and liver disease often develop. In severe ichthyosis, newborns may develop respiratory failure and sepsis, which can lead to death. Ichthyosis can be an independent disease and manifest itself only on the skin, isolated non-syndromic ichthyosis, or it can be combined with damage to internal organs and body systems, syndromic ichthyosis. The most well-known forms of ichthyosis: vulgar, simple, ordinary, serpentine, shiny, epidermolytic, congenital bullous ichthyosiform erythroderma, Broca's erythroderma, ichthyosiform epidermolytic hyperkeratosis, X-linked recessive, lamellar, dry ichthyosiform erythroderma, fetal ichthyosis, harlequin fruit. Ichthyosis can be congenital and acquired. Congenital manifests itself at birth or in the first few months after birth. Acquired usually develops in adults under the influence of various factors. Ordinary or vulgar ichthyosis manifests itself before the age of 3 years, but it is usually diagnosed before the 3rd month of life. This is the most common form of ichthyosis, inherited by an autosomal dominant type. At first, the skin becomes dry and rough. Then it is covered with small whitish or gray-black scales tightly adjacent to each other. In ichthyosis, the area of the elbow bends, popliteal pits, the area of the armpits and the inguinal zone are not affected. Mucoid peeling appears on the palms. The skin pattern becomes pronounced. The severity of the course of ichthyosis depends on how deep the gene mutation is. An abortive course is possible, when the only manifestation of ichthyosis is dryness and slight peeling of the skin on the extensor surfaces. With ichthyosis, hair, teeth, and nails undergo dystrophic changes. Dry brittle hair is characteristic. Nails break off and delaminate. Multiple caries joins. Quite often, ichthyosis is accompanied by eye damage, chronic conjunctivitis, and retinitis. Patients with ichthyosis have a hereditary predisposition to myopia, which begins to manifest itself in childhood. Since immunity is reduced, allergic diseases and purulent infections are permanent. Later, disorders in the work of internal organs are added. Most often cardiovascular insufficiency and liver diseases are noted. Recessive ichthyosis occurs only in males, although it is inherited on the X chromosome and differs in that the cause of the disease is a defect in placental enzymes. Clinical manifestations appear in the second week of life, less often immediately after birth. The horny layers of the skin look like large, dense scales of black-brown color and resemble shields. The skin between the scales is covered with cracks, so it looks like the skin of a crocodile or snake. Children with recessive ichthyosis often have mental retardation, skeletal abnormalities, and epilepsy. Juvenile cataracts and hypogonadism occur in 10–12% of cases. Congenital ichthyosis develops in utero at 4–5 months of pregnancy. At birth, the baby's skin is covered with thick horn shields of gray-black color. With congenital ichthyosis, the scales can reach up to 1 centimeter in thickness. The scales have different shapes, smooth or jagged. The skin between them is covered with furrows and cracks. Due to the dense, well-connected scales, the baby's mouth opening is either stretched or sharply narrowed so that the feeding probe barely passes. The ear holes are deformed and filled with horny scales. The eyelids are turned out due to stretching. Almost all infants have skeletal abnormalities. Clubfoot, myopia. Many children with a congenital form of ichthyosis have interdigital bridges on their feet and palms. Sometimes there are no nails. Pregnancy is more often premature, and the percentage of stillbirths is quite high. Since there are abnormalities incompatible with life, most children with a congenital form of ichthyosis die in the first days of life. Epidermolytic ichthyosis is one of the forms of congenital ichthyosis in which the baby's skin turns bright red, similar to a burn with boiling water. Nikolsky syndrome manifests itself positively. With a slight pressure on the skin, the rejection of epidermal scales is observed. The skin on the palms and soles turns white and thickens significantly. In some cases, hemorrhages in the skin and mucous membranes may occur with this form of ichthyosis. Such hemorrhages are an unfavorable sign, since they most often lead to the death of children. With a milder course of ichthyosis, the number of bubbles gradually decreases, but the disease can return in the form of outbreaks throughout life. During an exacerbation of ichthyosis, body temperature often rises to high values. By the 4th year of life, thick gray dirty scales can form on certain areas of the skin, which mainly appear in the folds of the skin. Children with congenital ichthyosis often have defects in the nervous and endocrine systems, as well as other diseases. Some of them later encounter oligophrenia, spastic paralysis, and other complications caused by the accumulation of phytanic acid in tissues. Polyneuropathies, anemia, and infantilism can worsen the course of the disease. The high mortality rate is due to both concomitant complications and associated diseases. The prognosis of ichthyosis is always unfavorable, since even with mild forms of the disease, the addition of systemic pathologies and the progression of metabolic diseases lead to complications. The main prevention of ichthyosis is counseling before pregnancy in order to determine the degree of genetic risk. If fetal ichthyosis is detected during the analysis of amniotic fluid, then termination of pregnancy is recommended. Couples who have a rather high risk of having a child with ichthyosis should refrain from pregnancy in favor of adopting orphan children. Diagnosis of ichthyosis. Most often, clinical manifestations are enough to make a diagnosis. Collecting anamnesis allows you to clarify whether relatives have the same disease, that is, whether ichthyosis is hereditary. Histological analysis. This is a study of a skin area that was taken from a patient during a biopsy. The analysis allows you to confirm the diagnosis. Histological changes. In vulgar ichthyosis, hyperkeratosis, thickening of the stratum corneum, the granular layer is thin or absent. The Malpighian layer, basal and spiny, is thinned. Sweat glands are affected in places. There are no inflammatory changes in the dermis. In the bullous form with bubbles, vacuole damage to spiny cells. 1. In autosomal recessive ichthyosis, hyperkeratosis, the granular layer is preserved, acanthosis, thickening of the spiny layer. Clusters of lymphocytes are noted around the vessels in the dermis. In X-linked ichthyosis, an expanded stratum corneum without thickening. Unlike vulgar ichthyosis in this form, the granular cell layer may be normal. Prevention of ichthyosis. If there are cases of ichthyosis in the family, the couple needs to undergo genetic counseling during pregnancy planning. DNA diagnostics allows you to determine whether future parents have mutant genes and how likely they are to have a sick child.